We do phase one whenever we feel like there's a need to accomplish a goal at that early age.
And what would you do in phase one?
In phase one, a patient might just get an expansion appliance. They might just get limited braces. They might get a type of appliance with springs on it that can move some teeth minorly, minor tooth movement type of appliances. They might get some type of extraction of baby teeth to make room for permanent teeth. There are a lot of things that could happen at phase one.
Is there a philosophy behind starting that young?
It's a relatively new philosophy. Most people aren't aware that when they think back to their childhood days, they remember that people didn't go to the orthodontist until they were age 12 or 13 years old. But over the last 25 years or so, we have started treatment at earlier and earlier ages, and dentists and orthodontists and the general public are seeing the benefits of that and referring more and more patients at that early age. And my own personal philosophy is that not everybody has to have something at that age, but if we see severe crowding, severe constriction or jaw malalignments, or severe protrusion and spacing, I would recommend doing something early to help correct those problems now at an early age, so the child does not have to go through the pre-adolescent years with teeth that are not very attractive. We can fix those problems now and deal with the rest of the issues later. Correct the bite completely at a phase two, finish the general alignment if any is warranted. And sometimes children who get phase one don't need phase two, in which case then a lot of times the parents can save money by starting a phase one treatment. But in our office, if we do need a phase two treatment at a later age, you get a big discount off the treatment fee for the active treatment and braces, because you've already paid a lot of money at phase one.
Okay. So phase two, they see crowding happening. What would bring a family in then to look at even considering phase two?
Well, usually if they've already had phase one, treatment, we're going to keep the child under observation. They're going to have retainers to maintain the alignment of their permanent teeth. As they continue to grow and develop and lose baby teeth and permanent teeth come in, we'll be monitoring them. We'll watch them. We'll have them come in about every 4 to 6 months, watch their growth and development. And when the time is right to consider phase two, if it's something that we feel like it's warranted, we would explain the circumstances to the parents and the patient and let them make a decision if it's something they want to do. If a situation arises where they don't need phase two, then we make new retainers to hold the position of their permanent teeth and continue to monitor them with retainers. Phase two usually occurs around age 12 or 13 years old.